Hello, welcome to Coffee Chat with Tiffany. My favorite mug, a little decaf today. And today we're talking about why is it so hard to get short notice home care? Like why can't there just be an Uber that when I need care for my mom, I can just order my caregiver up and get home care. Just a qualified caregiver. And there are actually, it seems like it would be easy, but there's actually a couple of reasons it's not. One is regulation. So for medical and non-medical agencies in most states, and this is true in Delaware, there are requirements around bringing on a client. So we actually have to do an assessment, a start of care assessment, and create a care plan prior to having a caregiver come and provide care to mom or dad. So that means that if you call us at 9 a.m., and you need care immediately, we still have to get a nurse. In our case, we're a home health agency. We still have to get a nurse out there to do a start of care assessment and do the care plan. And then, of course, we have to find the caregiver to match with you. So regulation is one of the reasons. The second reason is business model. So our business models, most home care workers are W-2 employees. This means that they're, background checked, fingerprinted, drug tested, they're licensed, bonded, and insured. If you were looking at a model where there was just a platform that matched you with a caregiver and you went direct to the caregiver, then these are typically 1099 employees. They should have their own workers' comp, which can create a legal issue for you because most of them don't. And they don't have to do continuing education. They're not necessarily covered under an agency for being licensed, bonded, or insured. So that model also lends itself, if you want that coverage, if you want to make sure that you're protected in that way, our business models for home care and home health just don't allow us to rent out our employees. And doing it on your own, it can be difficult to verify all those things. In addition, for medical agencies, all of our care is provided either by certified staff. So either CNA, home health aide, LPN, or RN. So again, kind of not the easiest thing to verify all of those certifications on your own, which is why just selecting someone off of a platform without having an agency can cause some problems. So what do you do if you want respite care or short notice care for mom or dad? The easiest thing to do is actually to get on with a home care or a home health agency and stay on their roster. So you would call us up, you would say, hey, I don't need you now, but I do need a backup plan if I'm unavailable or I need someone to go take care of mom or dad. And so we would come out, we would do our start of care assessment, we would create a care plan, and since we're a medical agency, we would also get a physician's order. And we would keep you on board or keep your parents on board. And every 60 days, we would come out and do a reassessment and a new care plan. So what would this cost? Probably between $75 and $150 a month, or $150 for an assessment, depending on how it's billed. And that would be for us to continue coming out and renewing those visits, that start a care assessment we would do. And then ongoing would be, they're called recertifications or recerts, and we would do those every 60 days. For a non-medical agency, it would just be every 90 days. And so then we can keep you on board anytime you need short notice visit or like respite care, like you're going away and you're gonna need care, then you're already on the roster, we already have all the information, and we can step in at any time. PSA for short notice visits. It is based off of availability. So if you call short notice, obviously we do everything we can to accommodate a short notice add-on. Our existing clients get priority, so that would be you if you're already on with us, but it is based off of availability. And so one of the things to know is that short notice requests can result in a higher rate. So a lot of agencies will charge time and a half if you want to have people come out with less than 24 hours notice. So that's just something to know. The further out that you can plan, the better. And then the more chance we have of matching you with the right caregiver for your visit.